Yes, good morning to you. Yes, we are outside of Henry Ford Hospital on Grand Boulevard, but the health system as a whole, as you mentioned, say that they have about 500 patients with COVID-19. They say this is the most they've seen since this time last year.
We are very worried about the accelerating pace of the new cases that we have seen in the state and the number of people being hospitalized with COVID.
We've learned right now Michigan has the most COVID-19 patients hospitalized and in the intensive care unit in the nation.
We know that people are fatigued, but people's non-compliance with the safety measures that have protected us for months now are giving this virus new life.
We're taking an in-depth look at hospital capacity in the region. For example, at Henry Ford Health System, out of 500 COVID-19 infections, 25% of those patients are in the intensive care unit. At Ascension Providence Hospital in Southfield, 43 patients have COVID, 16 are in the ICU, 86% of the beds are occupied. At Beaumont Royal Oak, 193 patients, 16 in the ICU, and 95% of the beds are filled. At University of Michigan Hospitals and Health Center, 99 patients, 24 in the ICU, and 90% capacity. Dr. Justin Dimick, the chairman of Michigan Medicine's surgery department, posted a plea for state and federal help on Twitter yesterday. The department is canceling surgeries because of an increase in COVID-19 hospitalizations.
Some have asked, including the CDC, for our leaders in the government here to consider whether at least a halt on some of those in-person sports activities at the K through 12 level might be in order.
Now, Henry Ford COO here says that they're having to meet twice a day to determine whether or not they should cancel elective procedures. And he says that the only way, or one of the ways that they can stop this surge, is to stop the obvious ways of this infection spreading. Reporting live in Detroit, Darren Cunningham, 7 Action News.